Hello, my name is Tanisha Bradley and this is my Unit 18 on health promotion. What is health promotion? Health promotion is when an individual is given advice, help and resources to boost both their life skills, lifestyle and overall health. There are several current health models. This includes social model, the social economical model, the health belief model, the social cognitive model, and the stages of change or transveratic model. The social model. The social model focuses on the factors that impact an individual's health. This can include restricted access to healthcare, social relationships, and financial stability. When the social model is used, it allows professionals to understand what factors affect the individual to prevent and avoid health qualities. The social ecological model. This focuses on the individual's environment and helps them understand links between both the individual and the environment they are in. The social ecological model theory was developed in 1977 by Bro-Finger. This consists of a diagram showing the different factors that influence an individual's behaviour. This can be age, education, income, the relationships with their family, peers and friends, the community they live in, and also their social and cultural norms. The health belief model. This was created in 1950 by social psychologists. It gave a better understanding and helped professionals foresee how an individual would behave towards their health. The health belief model. Perceived susceptibility. This is how likely the individual is to develop a disease or health condition. Perceived severity. This is how the individual reacts to the news of being diagnosed to said disease or condition. Perceived benefits. This is how the individual responds to the possible treatment plan and how they are effective. Perceived barriers. These are step backs. This can be not having enough support, treatment, or financial struggles. Cues of actions. This is how an individual takes action. This is based on their internal factors. This can be experiencing more discomfort, such as attending appointments and researching information on their condition, making them more anxious. Self-efficiency. An individual's belief if the cue of action is successful or not. The social cognitive theory. This focuses on how the environment around you affects your behaviours. This can also affect the way you act, think and process information. The social cognitive theory includes modelling. This is when someone sees someone behaving in a certain way and you adapt the behaviour in the same situation. The stages of change. This is a 6-change model created by psychologists in the 1960s. This was to originally help individuals with their drinking habits. The theory suggested if an individual recognises the issue, they would want to change. The 6 stages consist of the pre-contemplative stage. This is when an individual is in denial about the issue or condition. Contemplation. This is when an individual has to decide by weighing up the positives and negatives of the situation. Preparation and determination. This is when an individual decides what they want to change and what support they may need and want. Action. This is when an individual starts making noticeable progress in their condition. Maintenance. This is when an individual has been progressing over time, and this is when an individual has taken action for a long period of time and has seen growth. Relapse and termination. This is when an individual has gone backwards within their progress and has to decide whether it is worth it or not. This is in a continued loop. The comparisons of the health belief model and the stages of change model. Both of these models focus on how important it is to change behaviours and promoting health. Both models understand that behaviours can be influenced by the social settings and the environment they are in. Both models recognise the need for interventions. The differences include: they focus on different concepts and have different approaches towards health promotion. The health belief model focuses on an individual's risk and self-confidence, whereas the stages of change focuses more on the individuals willing to recognise the issue at hand and make a change. How effective are these models? The health promotion models can be used to have a positive attitude around health and behaviours. However, it depends on a number of factors. These include what health promotion model is being used, who is it aimed at, how the model is being used, and which setting the model is being used. With this being said, there are a few things to consider and how effective the health models are. Health promotion models use both direct and indirect observations, meaning they have a better understanding on different behaviours around them, and different behaviours, allowing them to customise them to the individual. They also take a tailored approach by getting to know the individuals and knowing their needs to know what route of treatment they may need. Changing the behaviours to more positive ones, such as setting realistic goals and having support network. Maintaining long-time behaviour changes, which leads to improvement in health, rather than using short-term fixes, which can cause relapse. Health Promotion Initiative, Change for Life. This was launched in 2009 to help tackle obesity and educate children and educate about the health risks it can lead to. The initiative was originally aimed at parents with children between 5 and 11. Their goals included alerting families to how much sugar is present in food and drinks and what are the dangers of having too much. Using customised approaches to suit every individual and family. Easily accessible support and advice via the Sugar Smart app, which allows you to scan food and drink items to see how much sugar is added. Prompting parents to buy less sugary food and drinks and opt for lower sugar, sugar-free and natural sugar options. What are their aims and objectives? They encourage people to eat 5 fruit and vegetables a day. This can be swapping out foods, hiding fruit and vegetables in foods such as homemade soups and sauces. They also suggested using the 400, 600 and 600 approach. This was to monitor calories throughout the day. They suggested that breakfast should have 400 calories, lunch should have 600, as well as your dinner. This allows a balanced meal throughout the day. Their aims was for the public to watch the salt intake and know the risks it can lead to. They also encourage families and individuals to swap to reduced salt to no added salt versions. How effective is Change for Life? The initiative used a number of ways to boost their audience, such as social media, school workshops, TV adverts, and a user-friendly app. By doing this, it saw 413,466 families sign up within the first year, with 44,000 of them actively still using the app 6 months into signing up. The feedback from families noted that they saw a noticeable change in their children's behaviour whilst making these swaps in their food. The platform also got 1.9 million responses within the first 12 months of being launched. What role do agencies and organisations play when improving public health? This includes raising awareness and educating the public to have a better understanding on possible health risks and how to prevent them, making sure everyone has access to healthcare services, putting rules and regulations in place on certain products such as tobacco and alcohol sales, analysing data and researching current strategies to see if they are effective or not, then finding ways to better and improve these. Public Health England. Public Health England help promote healthy living. They achieve this by monitoring and researching current health trends, offering advice and support on ways to improve your health, as well as addressing your health issues and concerns. They also help tackle equality, making sure everyone has access to healthcare, making it fair. How effective are these agencies? They monitor disease breakouts, mortality rates, the quality of life and life expectancy to see if there's a pattern. They also carry out research such as surveys, focus groups and questionnaires to see how the public feels and what changes need to be made. They also monitor the public's willingness to participate in spreading awareness. In conclusion, health promotion allows individuals to have a better understanding and control over their health and their health behaviours. It allows individuals to feel like they have a voice regarding their health needs. Thank you. This has been my Unit 18 on health promotion.